This is Health 54, the program that lets you in on health-related issues across the 54 African countries and the globe, right here on your digital first Pan-African News Network, TOS Television. I am Rose Audu. The federal government of Nigeria has set a target to eradicate malaria and reduce the mortality rate to less than 50 deaths per 1,000 births by the year 2025. This is coming as the country joins the rest of the world to commemorate the 2021 World Malaria Day. This initiative was made known by the Honorable Minister of Health, Osage Ehanire, at a press briefing to mark the World Malaria Day in Abuja. While giving his brief on the move by government to combat the disease in the country and completely wipe it out, Osage explained that at least 1.89 trillion naira would be needed to achieve the target. And report has it that malaria is still killing many Nigerians, including children and pregnant women, in spite of efforts towards reducing the burden of the disease. This is happening as some countries in the region have achieved elimination of the disease or near elimination. According to the World Health Organization, malaria is a life-threatening disease caused by parasites that are transmitted to people through the bite of infected female Anopheles mosquitoes. Some of the symptoms are fever, headache, vomiting, diarrhea, profuse sweating, and anemia. And to avoid death through yellow fever epidemics among the World Health Organization member states, WHO, in collaboration with the United Nations Children Fund, UNICEF, and other health bodies, has embarked on a yellow fever preventive vaccination exercise in the Democratic Republic of the Congo, aimed at eliminating yellow fever spread. The vaccination exercise targets more than 16.3 million people and considered to be the first such drive against the disease in Africa in 2021. The campaign is being carried out in 7 of the Democratic Republic of the Congo's 26 provinces among people aged 9 months to 60 years, including nearly 300,000 refugees. And on Thursday, the South American nations of Brazil surpassed 400,000 coronavirus-related deaths, the second highest total in the world after the United States. More than half of those were recorded in 2021, while April has been the deadliest month since the start of the pandemic. Experts blame several factors for the recent uptick, including the more contagious P1 variant, fatigue with restrictive measures such as lockdowns, and slow vaccine rollout. With 50% of the deaths from COVID happening this year, it shows that the crisis is totally out of control. Justin Orellana, an epidemiologist with the Cross Medical Research Institute in the Amazonian capital of Manaus, made this declaration. A consultant hemato-oncologist and the founder of Marcel Ruth Cancer Center and Specialist Hospital Lagos, Modupe Elubute, has solicited support for people living with cancer. Elubute, at the unveiling of the health facility, said Nigerians do not have to travel abroad to receive cancer treatment. She noted that the hospital would offer world-class cancer treatment to Nigeria and sub-Saharan Africa. This is TOS Television Network and you're watching Health 54. Do stay tuned. Welcome back. You're watching Health 54 on TOS Television Network. A mental health expert, Dr. Ada Ikeakor, has analyzed the danger of depression, and she talked about who is likely to be at risk. According to her, depression is one of the most common mental disorders affecting so many people all over the world. Ada said anyone could be at risk of getting depressed at almost any age. But the reason some people become depressed are not always known, as the causes differ from individuals. Let's hear her.
A depressed mood is a low mood. Sadness, some people have crying spells. For some people, it's irritability. So when you see someone that's always angry, always for the smallest thing, everyone around you is walking on eggshells. They're afraid of what to say because you might just you might overreact. One hallmark of depression and mood disorders generally is that tendency to overreact. So there's somebody in your office that's always overreacting. Don't just assume that they're just nasty. They really need to be screened for mood disorders, especially depression. Some people, it's anxiety, especially in women. Depression can manifest as anxiety. So what you call rumination, right? Where they're always worrying about one thing or the other. And that can be a hallmark. They coexist. Anxiety and depression are comorbidities. But some women, their depression presents more with anxiety. So you have sleep changes, For some people, their depression might be just poor sleep. They're not able to sleep, or they're sleeping too much. If you have a coworker that's always sleeping, that's a typical depression, right? For some people that are sleeping more than they should be, even in the daytime, they're always tired, they're always asleep, and suicidality, some people start thinking about killing themselves. Some people start thinking about killing others, which is not good, and so, we talked about concentration, sleep, weight. So you can have people that all of a sudden, that unintended weight loss, they just lose like maybe 3 kg in a month or 2 months, or they may gain weight, they may eat excessively to help them to feel better about their situation. And so you find somebody adding so much weight. So appetite could be increased or decreased. Sometimes depression can even present as restlessness, agitation. So the person is always restless and not able to sit still or sit in one place, and when they're talking they can be irrational sometimes, and sometimes when they're talking they may not even make sense.
Nigeria recorded 62 new cases of the novel coronavirus in the country. The Nigeria Center for Disease Control made this known via its verified Twitter handle. The new figure, the NCDC said, brings the total number of infections in the country to 165,055. The center said the new cases were reported in 10 states. It said Lagos recorded 38 cases, while Kaduna recorded 6 cases. Others are Ondo 6, Ogun 3, Akwa Ibom 2, FCT 2, Rivers 2, Edo 1, Kano 1, and Oyo 1. It said no new COVID-19 related death was recorded. The NCDC said that the virus had already claimed 2,063 lives in the country. And at least 50 persons have died from Lassa fever in Nigeria, even as the country is still grappling with the scourging COVID-19 pandemic. The figure reviewed by the Nigerian Center for Disease Control as of week 15, spanning April 12 to 18, shows that Lassa fever has continued a silent ascent in fatalities and infection. According to NCDC figures, 28% persons died between week 7, that is February 15 to 21, and week 15. The number of confirmed cases also climbed from 102 to 247 within the same period. The disease is non-prevalent in 14 states and across 52 local governments. An expert has said that at least 1 in 4 people had wider effects like a fever, headache, nausea, and fatigue from COVID-19 vaccination. But these only lasted one average of for 1 day. Researchers involved in the Zoe COVID symptom study app saw fewer reactions than were seen in clinical trials. Confidence in the vaccines has continued to grow since the end of last year, with more than 80% saying they believe the vaccines are safe and effective, compared with about 70% who said the same towards the end of 2020, according to a survey of 5,000 people. And the second wave of the virus is ravaging path of India, with 386,452 new cases reported on Thursday, the biggest one-day increase on record for any country. There were another 3,500 deaths nationwide on Thursday and nearly 400 in Delhi, a record for the capital. The total number of infections in the country has now passed 18 million. The first consignment of emergency medical supplies from the U.S. arrived on Friday, part of what the White House has said will be more than $100 million, equivalent of £72 million worth of support. But oxygen supplies and hospitals' beds remain in desperately short supply across India, with relatives of COVID patients pleading on social media for help. And following a second period of restrictions starting last November, the number of daily cases fell to around 6,000 at one point in mid-February. But as soon as the government started to ease the restriction in March, a new wave struck Turkey. The government made a U-turn to reimpose restrictions at the beginning of April. However, that was not enough to curb the spread of infections. At its height in April, there were more than 60,000 new cases a day and more than 300 deaths. According to critics, the government lifted restrictions in Turkey too early and the vaccination process has not been fast enough. More than 22 million vaccinations have been carried out, with 13.6 million people having received at least one dose in this country of 82 million. Turkey mainly uses the Chinese Sinovac vaccine, as well as lower numbers of Pfizer biotech. And South Africa added 1,086 more coronavirus infections to its case tally in the past 24 hours, for a total of more than 1.57 million. The country's health minister said late Thursday. The country's health secretary, Mkhize, announced that 46 more people had succumbed to COVID-19 related illnesses, bringing the total number of deaths to 54,331. According to him, we convey our condolences to the loved ones of the departed and thank the healthcare workers who treated the diseased patients, he stated in a statement in the country. And that is Health 54 right here on your digital first Pan-African News Network, TOS Television. For more updates, visit www.tostvnetwork.com. Do follow and like TOS Television Network on Facebook, Twitter, and Instagram. And remember to subscribe on YouTube. Do stay with us and enjoy more programs on TOS Television Network. I am Rose Audu, and many thanks for staying with us.